Hello, my name is Nilo, and I'm going to Anna Nilo. I'm an SEC student, and I'm going to perform the oropharyngeal and nasopharyngeal airways. So first, we are doing this to improve breath sounds on the patient and maintaining a patent airway. First, I need to check the orders for suction. See if there's any prescribed medication for pain as well. I need to gather all the equipment needed and organize it on the overhead table next to the patient. I need to perform hand hygiene, PPE needed, identify the patient using two identifiers. I need to provide privacy by closing the door and closing the curtains, and determine the need for suction and by assessing the patient's respiratory status, the respiratory rate, effort, oxygen saturation, and auscultate the lung sounds. I need to verify the suction orders in a medical record if necessary, and assess for pain and the potential for causing pain, and administer pain medication as prescribed before the suction. Explain to the procedure and the reason for suctioning to the patient, whether he's alert oriented or if he's unconscious as well. I need to reassure the patient that I will interrupt the patient if he has respiratory difficulties. Adjust the bed, lower the side rail, and I need to put the patient position in semi-folders. If he's not, then place the patient in side lying over here facing me, and move the bedside table close to me raise it to the height for working. And let's see. Okay, so once the table is a working height, patient is covers or lateral position, then I need to now put the waterproof pad or towel across the chest. Adjust the suction to appropriate pressure. The wall unit for adults, 100 to 150, neonates 60 to 80, mercury, infant and children 80 to 125, and the adolescents to 80 to 150 millimeter mercury. I need to put on disposable clean gloves, occlude or just cover the connecting tube to check the suction, and place the connecting tube in a convenient location. I need to use aseptic technique to open the sterile suction package. And the open wrapper or the container is now a sterile field, so that I can hold as a supplies there. Carefully remove the sterile container, touch only the outside surface. Set it up on the work surface, pour sterile saline into and place a small amount of lubricant in a sterile field, and take care, don't touch the sterile field with the package, okay? Increase the patient's oxygen level or apply the supplemental oxygen according to the doctor's orders. Put on the face shield or goggles, mask, or sterile gloves. Now the dominant hand is gonna dominate the catheter, and the non-dominant hand is clean, not sterile, and he's gonna control the suction valve on the catheter. If it's in the home setting or community, they don't need to have the sterile technique, okay? With the dominant gloved hand, now I need to pick up the sterile catheter, and non-dominant, pick up the connecting tubing and the suction catheter. Now I'm going to moisten the catheter by dipping it into the container of sterile saline and cover or top the tube just to check for suction. Okay, after checking the suction, I'm going to encourage the patient to take several deep breaths. Apply lubricant to the first 2 to 3 inches of the catheter. and using the lubricant that's in the sterile field. And then I'm going to remove the oxygen device if appropriate. Do not apply suction as we're inserting it. Hold the catheter between the thumb and forefinger and insert the catheter. Okay. If it's an oral pharyngeal suctioning, insert the OPA to an unconscious patient, moisten the tip of the Yanker suction catheter with a water saline, and pull the tongue forward using a gauze if necessary, but don't apply suction during the insertion. Advance the catheter about 3 to 4 inches to reach the pharynx along the side of the mouth, okay? It may be necessary for the oral pharyngeal to apply suction if you see any secretions inside the mouth and under the tongue, you can secrete it. For nasopharyngeal suctioning, which you do first, insert gently along the floor of the nostril towards the trachea and roll the catheter between your fingers to help advance it. Advance approximately like 5 to 6 inches to reach the pharynx. And apply suction by intermittently occluding it with a dominant hand and gently rotating the catheter, like as if you're going or as you take it out or you withdraw it, but do not suction more than 10 to 15 seconds at a time. And after you suction, you replace the oxygen delivery device using the non-dominant hand and have the patient take several deep breaths, flush the catheter with saline, assess the effectiveness of the suctioning, and repeat as necessary if the patient is able to tolerate. And wrap the suction catheter around your dominant hand between the attempts. Allow at least 30 seconds to a minute intervals if you need to suction more, okay? No more than 3 suction passes should be done per suctioning episodes, and alternate the nares if repeated suctioning is required, unless it's contraindicated. Okay. Don't force the catheter through the nares, and encourage the patient to cough and deep breathe between the suction. Okay, so suction the oral pharyngeal after the nasopharynx. So first the nasopharyngeal and then the oral. Once suctioning is complete, remove the gloves inside out from the dominant hand over the coiled catheter. So it's here, like this. Remove the glove from the dominant hand and dispose the gloves catheter and the container with a solution. And throw it in the correct receptacle or that's available. Assist the patient to a comfortable position. Raise the side rail. Lower the bed, get to lowest position, turn off the suction now, and remove the supplemental oxygen placed for the suctioning if it's appropriate. Remove your face shield, goggles, and the mask. Perform hand hygiene. Offer the oral hygiene to the patient after the suctioning, and reassess the respiratory status, respiratory rate, the effort, oxygen saturation, auscultate with lung sounds, and remove any additional PPE used. And finally, remember to do the hand hygiene again and wash your hands between patients. Thank you. I think this is the end of the nasopharyngeal and oropharyngeal sectioning. Thank you very much.